She won most talkative in high school, and she has been running her mouth ever since. Welcome to the Lisa Fisher Said podcast with your host, Lisa Fisher.
Okay, there's a lot you and I need to talk about because I love your social media and you really champion women's health. And two things I think that really will speak to people. And one is an epidemic. They both are. And one is PCOS. Let's talk about PCOS. Who's getting it? Polycystic ovarian syndrome. Who's getting it? And who doesn't know they have it?
Yeah, that's a really great question. And I love the way that you phrased it because I think classically we think of, there's a certain body type that we think of, right? A woman who's slightly overweight, thinning hair, cystic acne. But it could be women who are thin, women who don't fit that profile at all. And so I think those are the women that are getting missed because their doctors see them and they want to get tested and they're like, no, PCOS is bigger. And it's really unfortunate because I have come across that a lot.
Because if we will talk about the typical genotype or what we used to say we saw was a woman who, not just weight gain, but obesity was like
the truncal,
a side effect.
Right?
Yeah. Yes. Truncal obesity, the facial hair, the cystic acne, irregular periods.
Mm-hmm.
Now, a lot of women as they age will have some of those symptoms. Do you think women weave in and out of PCOS and then their hormones balance and then because they're perimenopausal, they might get there again? Or is it something you have forever?
I think because the big piece here, along with the androgens, is also the insulin resistance, right? So as women's hormones are fluctuating and they are becoming less sensitive to insulin, then they are more able to get into that PCOS-like picture, even if they don't technically fit the criteria. But I do think that as women, as we start to age and our hormones start to shift, if we're not mindful of correcting our lifestyle and our diet to fit those hormonal shifts, then yes, you can weave more into that pattern.
Well, the reason I even bring it up, because I know when I was in my 30s, I every month would have a cyst on my chin, right? So I would see my dermatologist. He would inject it because I've been on camera for 35 years. So if I had something on camera, he would inject it. And then he put me on, I'm sorry I took it, doxycycline, for a long time. Which it makes me mad now that I'm 100 years old. And I look back, I'm not, I'm 60. But I look back and think, why didn't anyone look at the root cause of what was going on rather than going, well, we'll get the needle out. We'll give you some antibiotics and you go about your way.
Right.
Now I'm wondering, was I one of those that was kind of weaving in and out? I don't remember having facial hair, but I had some other symptoms that my periods were starting to get erratic because it was perimenopause and there were just other things. So I guess it makes me angry now that I understand functional medicine and the why we get sick. Let's look at the root cause, that people don't look at that. So do you ever suggest to somebody, because I know one thing I hear all the time is, we'll just take birth control pills to these women. And I can assume as a naturopath, that's probably not your first line of defense, but what are the things then? What do you tell women to do if they start presenting with these symptoms?
So yeah, that's another great question. And you're absolutely right. If they're presenting with these symptoms, birth control pills are not my go-to.
Can you say that again? Say that again. Birth control pills are not her go-to if these are your symptoms. I just have to say it because I swear I hear this every day.
Yeah, it's true. And it's really, really unfortunate because I've worked with a lot of women who are not even 30 years old, but they've been on the pill for 15 years, over 15 years. And it's not even because they were sexually active at that time. I mean, if you're taking the pill for contraceptive reasons, which is what it was made for, then
that's right.
More to you. Go ahead. That's your choice. That's, right. That's your prerogative. Fine.
That's right.
However, at an 11 years old, and I always ask, well, okay, was this for contraceptive purposes? Not coming from a place of judgment, but hey, if you needed it, you needed it. And
right.
They're like, oh no, it's because I had a little bit of acne, or it's because my periods were irregular. Well, when you're first starting to get your period, you're not really having a regular period to begin with. So yeah, it blows my mind. And what I like to do first is, so okay, if somebody's coming in with acne and it is coming around a certain time of the month, then we'd look at, okay, well, what is your diet like? Because during your second half of your period, you're going to want to focus on more proteins, fats. Your body's not metabolizing these carbohydrates as well. So maybe look at that piece, right? Look at how they're exercising. Look at the stress. I think another overlooked piece is stress, especially in women. Like, we have a lot of women doing amazing things, but it's at the cost of our hormonal health. And not to say that we can't do it all, we can, but it does come at a price, right? So when you start to really, burn the candle at both ends, and you're getting up really late, getting up really early, staying up really late, not nourishing your body properly, this is all stress on the body, and your body's going to pump out more cortisol, which is then going to signal more release of blood sugar. And so that blood sugar dysregulation piece, as it ties into PCOS, I think is largely overlooked, because then diet alone is not going to be helpful, right? So I think looking at all of these different areas and making the corrections, whether it's diet, whether it's lifestyle, and starting there.
One time when I was really starting to get interested in this, and I understood Dr. Ben Bickman say in his book, Why We Get Sick, he talked about PCOS, and his whole book, the whole premise of that book, Why We Get Sick, it's the, things that afflict much of what, not just Western society, but the planet, right?
Mm-hmm.
If 92% of the people are metabolically unfit, that's one thing. And there's high blood pressure and high triglycerides and PCOS and end-stage renal disease, all these things. And he says the root cause is insulin resistance. Okay. So I used to wonder, and now I have my theory, and I wanted to see what you think. I used to wonder which came first, the chicken or the egg, PCOS or insulin resistance. And now I'm thinking insulin resistance is what spawns the PCOS, not the other way around. What do you think?
I agree with that. I would agree with that. Yeah.
And see, that's where a parent might give you some pushback, because they think of insulin resistance as
a result.
Yes, that's right. So we're trying to say something, what the root cause upstream, something is not, your hormones aren't regulated. Then how do you then, so the 11-year-old who comes to you, or the 12-year-old, these really young girls might be seeing it, because we know girls start their period. We all, girls start their period at 11, 12, 13, whatever it is. And they're coming in with these symptoms. Do you attack diet first?
So if I usually don't work with anyone like that age. By the time they come to me, they're much older. But yes, theoretically, I would look at diet. I feel like that is always a safe place to start, especially in the younger population right now. The food is largely processed and it's largely carbohydrate based. Yeah. So I would absolutely start with diet.
Now, I would assume from your genetic makeup, are you a vegan, vegetarian?
No.
Or were you raised that way?
No, actually.
Okay.
No.
Because I was thinking maybe you were Indian or South Asian.
South Asian, but more so Pakistani, so not vegan, not vegetarian.
More meats, yeah.
Yep.
Because I was wondering then how Asian cultures deal with this, because if they're vegan or vegetarian, their diets are largely high in carbohydrates. So how is that addressed? If you are someone who's dyed in the wool, you have a philosophy or religion.
Yeah.
And it dictates that you not eat animal fats, which I base most of my diet on. So how do you then communicate? Because Pakistani foods, y'all got some good foods, girl. Man, I love that food. Some of my favorites. So, but how do you then help that person navigate a high carbohydrate diet?
That's another great question, because South Asian women do have a large predisposition for PCOS.
That's right.
I think
type 2, right?
Yes.
Type 2 diabetes is huge in the Asian community now.
Yes, and then both of those tie into your risk for cardiovascular disease.
Right.
So that is tricky, because I have seen a fair share, and I think at that point, it's still going to be, then at that point, it's going to be prioritizing food timing, making sure there's not snacking in between, and focusing on strength training.
Okay.
So really looking at the lifestyle piece, if the diet can't be modified. But yeah, it is tricky. It's much trickier in that scenario.
I think the other thing that trips people up too with the Asian community, what I've seen and I've heard people say, a friend of mine is, she is South Asian, yes, and she is a carnivore, meat-based eater. Her mother is not. Her mother's still eating vegetarian. Her mother's small in stature, but she's type 2 diabetic. So I think that as Westerners, we just think, well, if you gain weight, you have type 2 diabetes. That's not necessarily the case, because sometimes you do see it in small stature, like you said, even thin people with PCOS, right?
Yeah, absolutely. Absolutely. Yeah.
Something you mentioned, I think we really need to say it louder for those in the back too, is we've got to stop snacking. Our kids have to stop snacking.
That's huge.
And I know Big Food spends a lot of money to tell us that we need a Snickers and we need a fourth meal. And, I'm an intermittent faster, so I really say we don't. But how do you get that message across to people that you don't have to eat every 10 minutes?
Yeah, that is a big thing for people to wrap their mind around. And I think part of it is just at this point they're used to it. And so it's like they're bored and they're mindlessly doing it.
Yeah.
One of the ways that I try to get across to them is your digestive tract needs time to rest. You don't want it to constantly be working. And I try to tell them, like, if you eat a good amount of food when you do eat, and you're intentional about eating, and you're chewing your food slowly, you will find that you don't need to eat in between. And then if you do find yourself grabbing for something, ask yourself, am I truly hungry? Maybe have some water, and then, think about, do I need this? But it's definitely a mindset shift. So I think telling them and reminding them that you don't actually need to, especially if you're eating enough prior, like in a meal.
Well, I think one thing that's helped me, and I've repeated this before, and that's what Dr. Fung says, that we're hormonally wired to eat and to stop eating. And that if you the people who come to me, because I'm a health coach and intermittent fasting coach, well, Lisa, but I'm hungry several times during the day. And I said, because you're hormonally wired to eat the food, because you've been on this roller coaster with your glucose for so many years. And it's surprising, Dr. Nadia, how quickly it is to reverse that. I never thought that I could have been the person that I've done a 5-day fast. I've done a 3-day fast. Never in my wildest imagination did I ever think I could go 2 hours.
Right.
Have you seen that in your practice or with yourself?
Yes, absolutely. I used to be someone that snacked a lot. But I think one of the things that I realized for myself personally is seeing how much of that was also from a programmed stress response almost. So because my body had been so used to getting this blood sugar spike from cortisol, then if I wasn't getting it from stress, then it felt like I had to get it from food. I had to get it from somewhere, right? So it was a big shift. I actually think one of the things that helped was Prolon. Prolon. Yeah. I really liked that. For me, so I had fasted for years, but again, for me, it was a little bit more detrimental because of the fact that I just kept pumping out more stress hormone. So that's one of the things that I do talk about, is that if you do tend to have a higher sympathetic tone, then you need to be more, conservative with your fasting windows and skip dinners instead of skipping breakfast, or that sort of thing. Yeah. So as you get yourself used to it, then you can start to expand it. But Prolon was helpful because there was still that little bit of food that was going in, but I feel like that did help to reset things. So if someone is having trouble, I might recommend that they try Prolon as a way to give them just a reset.
And I'll put that in the show notes. It's the fasting mimicking diet that Dr. Walter Longo.
Correct.
And he's a fasting and longevity expert, so his is definitely based on science. It's probably $250 for, was it like a 3-day? I did it a few years ago, just
3 to 5 days.
3 to 5 days, something. Yeah. And it's not as good as mama's food, but you do eat. No. I remember eating soups and broths and something. I really don't remember.
Yeah. It's not the greatest, but I think it's a means to an end. And if you need that reset and you're having trouble, I do like it.
Would you tell someone with PCOS to try that?
I would. I would, but I would tell them that they might only be able to do like 2 to 3. They might not do the whole 5 days. Yeah.
Okay, let's talk about cortisol now. And cortisol's, it's important. It's kind of like insulin to me. It's a double-edged sword. Have to have it.
Yes.
Can't live without it. Same thing with cortisol. We have to have it to get things done, but too much of it, we get cortisol drunk, or then we blow out our adrenals. The thinking is. So for some people, we know that fasting is a hormetic stress, which meaning your body can get through that. Your body needs a little time of hormetic stress. But for some people, and we're all individual, we're all different. Some people, that hormetic stress is too much for fasting and it produces too much cortisol. Is that what you kind of were thinking with your own body?
Yes.
And how did you know that? Like, what are the signs and symptoms?
I think it's the trouble, like the truncal obesity we were talking about. So trouble losing that belly fat. Feeling like you're getting sweaty, or just because for me it was just so that's one of the signs that you'll see, like with that lower blood sugar, like you're not hot but you're like sweaty, and it's like you're pumping out that stress hormone. What else? Clammy,
like, is that when
yes.
I know what you're talking about.
You might get you might start to have similar type symptoms of like when you're hangry, right? Like when your blood sugar gets low, you get a little bit irritable. Maybe having trouble sleeping at night, so waking up in the middle of the night, wired. So those were all some signs of that higher cortisol when it's not supposed to be high.
Then how did you alter? I'd like to hear what your path was then, from fasting to maybe reducing the fasting and more feasting.
Yes. So I had to reduce fasting for sure. What did I do?
How did you start? What was your fasting and feasting to start with, or when you were in your prime?
When I was fasting, I would, at the time I was in school, so it was very convenient because I would just not eat. And then when there was, I had classes. Is that what you mean?
Yes, but that was a very stressful time too. Anyway, so you were pushing out cortisol from that.
Exactly. Once I finished, I kept that same pattern.
And that was too much, maybe.
Exactly. And that's when I noticed, that's when it started to really click to me. When I'm like, well, why am I really stressed if now I'm in an environment where I'm in control, I'm not adhering to, a particular schedule, and I'm still feeling all of this. And that's when I started to put it together, like, oh my gosh, this is too much for me. My body has adapted to being under high stress. I need to switch this. So I stopped the fasting. I started making sure that I was eating within the first hour of waking.
Okay.
And I stopped coffee. So, I'm one of those that I don't see an issue with coffee. I love coffee. I think if you're not having more than 2 cups a day, fine. But when you're, again, trying to shift your body's stress response, then you need to remove that added stimulation. So I stopped all coffee. I was having green tea. And I started to eat a little bit more carbohydrate than I had been. And then slowly over time, as I started to feel better and started to see that my sleep, my energy levels were better, I wasn't getting as clammy. I think that was a big one for me, that I wasn't getting clammy. Then I started to, I can stop eating earlier in the evening. So I still, like, if I stop eating earlier in the evening, I still try to eat within the first hour of waking. But now I'll experiment with ending my eating window earlier in the day.
Yeah, and the science is showing us that because of insulin sensitivity throughout the day, that we truly, in the beginning, I preached skip breakfast, eat lunch and dinner, or eat at 4 p.m. to 8 p.m. Now, Dr. Hyman's talked about it, Andrew Huberman, Ben Bickman, they've all said, well, not so fast. If you're going to skip anything, skip dinner, because of circadian rhythms and insulin sensitivity. So that has definitely changed my position on this, and to support people to say, and really, no one's ever heard me say this. I think if you're starting a fasting lifestyle tomorrow, I would say now maybe it is best to eat within an hour from when you wake up, and then finish up at 2 or 3. And that's kind of new for me because, again, because in our society, families want to have dinner together, husbands and wives want to visit. And I go, you can still visit. You can still sit there with your water, my club soda, and the salt around the rim. And, I'm still with my family. If my husband and I are together,
Sure.
I can skip. No one really notices, but you feel real self-conscious because you think, well, I'm not here participating. You're still there. You're still a human. You're still alive, right?
Yes. Yes, absolutely.
So that was, you were kind of mitigating a cortisol response at that time. Was there any
Yes.
way for you to measure, did you do saliva testing to see what your
Yes.
adrenals were doing? Well, tell me what they
Yes.
were then in the heightened cortisol when your spike was later in the day, and then maybe, or how it flipped.
I want to say it was just high
It's just
all
high
around.
all the time, yeah.
Yeah, it was, if I'm not mistaken, my curve was just higher than it should have been.
Yeah.
For all the times of day. So
What is your eating schedule now? So you're eating within an hour still now?
yes,
Of waking?
within an hour of waking. Yes. For the most part, if I do play with like a little bit of a longer window, I do talk to women about just doing it according to where you are in your cycle. So in the first half of your cycle, you can tolerate a more intense fast, I guess you can say. So I might go 2 hours or 3 hours. Again, but that's also because now I gauge and I know how I feel. I know when I'm pushing it.
Well,
So
the thing you're teaching people is listen to your body.
correct. Because that's really what it comes down to. What works for me, and this is all my past history and how my body has adapted. So that's going to be different than it is for someone else's. And when you bring up the cultural heritage part, that plays a big role too.
Sure.
Because South Asian, but also Hispanic, and those two sides very much influence my genetics and how they're going to play out, right? So, and for someone else, they might be able to go about that a little bit more easily.
Yeah. I would say, and Mark Hyman says DNA loads the gun, but environment pulls the trigger. So I definitely respect that. But we do have to look at some of the things about our heritage. And the Hispanic culture also has high type 2 diabetes and insulin resistance, right?
Yes.
Yeah. Yours is a double whammy. I mean, I hate to say it, but
it
looks like you pulled it off fine. You're fine.
And yeah, that's the other thing, that people see their genetics and they think they're doomed, right? And you're not. You're not.
Boy, I'm reading or listening to Dr. Gabor Mate, his new book, The Myth of Normal. And he spends, I've just on the chapters, I'm listening to it. And his story is fascinating because he is an Eastern European Jew whose mother survived the Holocaust. And we're seeing now that's not the survivors of the Holocaust that had the disease and ailments and conditions. It's because of epigenetics. It's their children. Yeah. And it's what we take on from others. I mean, it's a fascinating book. Let me put that in the show notes too.
I love all of his work.
Yes. And you've seen him on a lot of, if you follow anyone in the health space, he kind of did the big run of everybody in like January, February, March, or whenever, the last 6 months. And you think, what is this guy saying? Because he kind of doesn't enunciate when he talks, and you're like he's mumbling. Y'all, he has so much valuable information. You need to go back and watch anything he's done. Get the book. He has a Native American or English speaker that reads his book because he has a pretty thick Polish. He's probably speaking English for 50 years. I think he's in his 70s, maybe older than that. But yeah, it's a fascinating book. Okay, so we talked about the one thing that affects so many people, that it's epidemic, and it's not maybe epidemic yet, but it's PCOS. But the other thing, now you're going to be speaking to both men and women on this, and it's hair loss. And I know you kind of have a big passion about hair loss. So tell me what got you interested, and we'll talk about the panacea? What's going to fix all of anybody who has hair loss issues?
Yeah, so it's interesting. I started consulting for a hair company, and shortly after, I started experiencing my own hair issues. And the funny thing is then I'm working with this company, and they're like, "Here, you have all of our resources. Take all of our stuff. It's free." And it wasn't working for me.
That's
So
interesting.
so at that point, I'm like, I mean, now when I look back, I'm like, okay, I get it. You know, I had to really dive into all of these avenues because it's really so much that affects our hair and their follicles. They have their own environment. You know, they produce hormones on their own. They produce, they produce like DHT. They have receptors that are responding to different things as well as they're responding systemically. So anyway, I start losing hair and it's not being helped by these other products. I start to see the impact of environmental toxicities and how huge that is. Our emotions, so huge. At the time, I didn't even, realize how much I had gone through. Like it was, you know, I had finished up school. I had, you know, my board exams. I got married. I moved twice, one of them across the country. And then I think what really did it was I spent a little bit of time. I think it was like 3 to 4 months in home with water damage.
Oh, wow.
And yes, being, I think, mold sensitive, which I hadn't realized, that was what really did it. So it made a lot of sense that everything that I was taking and doing wasn't helpful because there was this augmented inflammatory immune response that was just constantly going in the background, draining all my antioxidants, draining nutrients. And then that also shifts your hormone balance, you know? So, it took a lot of time.
It's a slow, arduous comeback.
It's very slow.
Regrowth.
Very slow. Very slow. And, then at that time, so still studying and all of this. And then COVID happens. And then, so we start seeing the influence of COVID and hair. And again, the theme that was tying into everything was the impact of inflammation and all of the inflammatory chemicals and signaling that ends up impacting the hair and disrupting the hair growth cycle. So that really being the common theme.
Did you get COVID?
I did.
And then did you have the hair? You know, a lot of people had the post-COVID hair loss.
Yeah. Well, let me back up. I don't actually, this is a funny story. I don't actually know if I had COVID because it happened so early. So my husband was in residency at the time. And I was so sick. Like this was early March of 2020, and no tests. And he at the time, you know, he's in the hospital, and he gets a call one day when he's home, and he's like, "Okay, so the patient that you've been seeing, he just tested positive for COVID. You have to stay home." So there was never a test. He never got sick, but the way that I was sick, I mean, I had never been that sick. And then a month after, there was like literally a section of hair missing. So I'm like, it had to have been COVID. We never confirmed it, but
looks like a duck, acts like a duck, quacks like a duck. It's a duck. Okay. You don't need to take a duck test to tell me if you're a duck.
Right.
I'm tracking with you the whole time. But then you had it's the post-COVID hair loss that has freaked people out.
And I think that, so what a lot of people don't realize is this can happen with any viral illness. It's just at the time, because there were so many people that had this same illness, and so then it got associated with that. But it can really happen after any extreme viral illness.
And not just viral. I mean, that's another thing.
Not
Stress,
just viral.
Well, thyroid disease. That's kind of, for me and a lot of women who finally get diagnosed after having babies, when you go back to because the only doctor you see as a new mom is your obstetrician, right? For your follow-up.
Right.
And you say, well, I have a lot of hair loss. Your obstetrician will pat you on the leg and say, we just had a baby. But and that does affect your hair loss. But for me, I remember my thyroid was blowing out. It was dying. My antibodies were off the page kind of thing. And, again, it's digging deeper and trying to find a root cause. And I would think anybody listening, just don't take the answer is just because. Try to find the root cause. But with hair loss, I bet it's a difficult thing, because isn't hair like on a 6-week or 3-month cycle that you have hair loss today, but it was something that happened 6 to 12 weeks ago? Yeah, 3 months ago.
Yep.
So do you have to backtrack and try to figure that out?
Yeah, but the tricky thing is if there was something extreme enough, like there are cases where people have experienced extreme trauma, and from one day to the next they lose a significant chunk of hair. So so classically, yes, it's 3 months.
Okay.
But if it's significant enough, it could be, yeah.
But hair loss
so it depends
is
how your
a
body's
symptom. Like, we need to pay attention to it.
Absolutely. Okay. Absolutely. And I think that's it breaks my heart with women. Like you said, they don't get listened to. Their hormones are, it's just your hormones. And 2 months postpartum, like, okay, but if it's continuing, that's not just postpartum.
That's what I was saying at 6, 9, 12 months, a year and a half. Still where I would, my friend calls it, she would brush the floor, comb the floor, because you have to pick it up. And I see it here all around me, because kind of as a thyroid patient, even though I keep a short leash on my thyroid. I do take NP thyroid 5 days a week, take 2 days off. I still have a lot of hair loss. I just think as an autoimmune patient, here's the one thing that makes me mad. It's because I have a ton of hair, and you do too. And then people saying, well, you have a lot of hair. I'd like to keep it. Yeah. I would like to keep it.
That's something I would hear a lot from patients, is like they get dismissed because they're like, but you have a lot. Mm-hmm. Okay, for now, but if this continues, then
well,
what?
Full disclosure, my stylist, and she sees my hair every week because, I think I'm a Kardashian. I have to have a blowout on Wednesdays. Sorry, this isn't a blowout day. It would really look good if it were Wednesday. So because of that, she keeps an eye on my hair, and because I have several autoimmune conditions, vitiligo, alopecia. I have alopecia now on my scalp. Now I'm going at it full throttle. Like, I want to hear all your advice, but I do think because I caught it early, I might even do PRP. My nurse practitioner said some people do PRP for alopecia. So alopecia, unlike what you heard in the media one time at the Academy Awards, it is not your whole head with short hair. It is round. It's completely circular, spherical hole of no hair. Wouldn't you say that's the definition?
That's the alopecia areata.
That's right. What I have. Right. The other one is complete hair loss. Right.
So there's totalis, there's universalis. So alopecia is more of a general term for hair loss, and then you can have the different types. So totalis and then universalis, that would be everything, and then the areata is where it's like you said, the focal.
The little clump. In fact, I am putting a little steroid cream on it, but even when my husband has to go to find it, he has a hard time finding it because he's like, you got so much hair, and I go, stop saying it. I want to keep it. But what are some of your tricks then for dealing with that type of hair loss? Because that's autoimmune, and that might be a little different.
Yeah. So we talked about how the inflammatory cytokines are a big thing that, like the hair follicles are very, very sensitive to that. So making sure that you're flooding the body with antioxidants. Something really interesting that I recently learned is when there is oxidative stress in the body, you cannot have optimal glutathione levels.
Ooh, that's good.
And you need optimal levels of vitamin C, but you can't get those optimal levels of vitamin C unless you have optimal levels of magnesium.
I love me some magnesium now.
So yes. So having good magnesium, good vitamin C, and most people, when they think about vitamin C, they're thinking like an emergency packet. Like, no, we're talking about 2 grams of vitamin. So 2,000 milligrams of vitamin C, you want to be doing, and that's, a high quality liposomal where you're really absorbing that and helping to counteract the damage from any oxidative stress in the body. Taking, your anti-inflammatory or inflammatory supportive herbs like your
Right.
turmeric, green
Right.
tea extract,
Okay.
things like that. I really like the use of peptides. There's a few that are really great for the hair, and they work really well in conjunction with the PRP or the PRF.
So what are the peptides? The only peptide I hear about is the glucagon-like, the GLP-1 agonist. But what are peptides?
While we're on that topic, I want to point out, I think we're going to see a big trend in Ozempic hair loss. They've talked about Ozempic face.
You're exactly right. And another thing, gallstones. Women are going to be running to their GI docs with this pain between their shoulder blades, don't know what's going on, and it's this rapid weight loss risk that gives you then have gallstones. And I wouldn't take my gallbladder out if, unless it was diseased or dying.
Yeah.
But I bet you're exactly right.
Yeah. I feel like I'm already seeing that, but they just haven't
named it. Yeah,
connected the two.
So what are peptides in it? I know that's a big buzzword, but I don't understand maybe what it is.
So the peptides are basically signal. So they're a string of amino acids, and they send a signal to the body. Okay. So different peptides will send a different signal. Yeah, and so the ones that we've so my husband and I have our practice in Miami, and the ones we most commonly use for hair are going to be GHKCU, and there's another one called thymosin beta. Okay. Thymosin beta. And so the thymosin beta actually acts on the immune system and has shown regrowth of hair when in conjunction with PRP or PRF, the microneedling. And then the GHKCU is it has copper. I can't remember what the GHK is, but the CU is copper, and that is really good for skin, for collagen. So those two are the ones that we're using a lot and seeing good success with that.
So we need copper, right? Or do we get too much?
We do need copper. We tend to get too much zinc because we take zinc for immune support, and the two they're cofactors. So when you take zinc, you should be having a little bit of copper. So I have my hair supplement, and it does have a little bit of copper in it to help with to make sure that there's that balance.
That makes sense.
Because
the copper, there are two things that always confuse me, whether we have too much or not enough. One's iodine, because there's one camp in the thyroid world, you don't have enough, you're not absorbing. Then the other part that says, no, that's the reason you have Hashimoto's, you have too much. And then it's the same argument to me with copper. I'm always like, do I want more, or do I not have enough? Do I have too much? So it always confuses me. Yes.
It's a delicate balance. For
and
both.
The thing about iodine is, it's measured in micrograms. So it is minuscule, the tiny dosing titration that you would have, and then you wouldn't. I mean, I don't know who has too much or not enough. I guess there'd be a lab test for that. Okay, now let's talk about, I heard Peter Attia in an interview, another longevity expert, talk about Ozempic is pushing us into, well, for one thing, I call it the fen of 2023, or the HCG diet of 2023, or it lasts for this long. It is, the thing about this one is it's all the rage, but the people who really need it, the type 2 diabetics, they can't get it because there's a shortage. Because Chelsea Handler said, her doctor even called and said, oh girl, I'm putting you on this medicine. And she swears she didn't even know what it was, that she goes, because everyone takes it. It's like I go to Ozempic parties. But Peter Attia was on an interview saying that what he predicts, because of the lean mass muscle ratio and what you're losing, he said he's a fasting proponent, so I'm sure he's using fasting as an example. In a traditional weight loss that's healthy, you lose this much of lean muscle mass and you lose this much fat, whatever. I can't do math, whatever the math is. But then with Ozempic, it's disproportionate to be redundant, but it is not what you want. And he said, we are going to see a future of weight loss, but not fat loss. And he said, then it's what Mark Hyman calls TOFI, thin on the outside, fat on the inside. Yeah, you lost weight, but you needed to lose fat. So can you address that and explain that to me? What do we want to lose when we diet, and what we don't want to lose?
Yeah. We definitely want to lose more of the fat. We don't want to lose our lean muscle mass or bone density. And I think to go back to what we originally started talking about, and the PCOS and the people who are getting missed, like this is the profile that we're creating essentially.
I see. Yeah.
Yes, we're creating it's the metabolically unfit that don't fit the picture. So these are a lot of people that are going to be missed because they're thin, because they've lost all this weight, because they're on paper, they look like, oh, their cardiovascular risk has reduced. But as they get older and they have this less muscle mass and less bone density, they're going to be more frail. I can't understand why. The thing about it is this: if there are some providers that I think are going about this in a responsible way and telling people like, okay, if it's a short boost that you need, but make sure you're strength training, make sure you're focusing on protein. I have heard practitioners telling patients, you can eat whatever you want and you're going to lose weight. And that blows I think that's where the bigger issue lies, is that people are not seeing the big picture of it all. There could be a way to make this a valuable tool, especially for the people who are and who do need this and who maybe just need that little bit of a push, right? Like they'll feel motivated because they see the weight starting to come off. So now they want to get to the gym. Now they want to make better choices. But I think for the large majority, they're just having it as a freebie.
Well, he said,
you know what I mean?
They're on it for life.
A lot, because they get addicted in the sense that they don't want to.
He said the weight rebound is so great. Then they're going to they will feel this obligation to keep themselves, because this glorified weight in their head, which you weren't designed to be. I mean, I've used 8th grade weight to be funny, because I had a podcast guest once who really did say, I went back to my 8th grade weight. So I said it to be funny, but I don't mean that, because that's maybe during puberty. Right. It's just not to age well. You need some fat and meat on you. But some of these people then, and the Kardashians can afford it. So it's great for them. But for the average person who really got on it to help them, yet they get off it and they might have the rebound of it, it might propel them to think, well, I'm just going to take this forever.
Right. And I think that's the other issue too, is the rebound comes from not going to the root cause. I know. So if they were working on that with it, like again, if you're needing that boost and you're also at the same time working on all of these other things so that when you do come off it, you have maintained your muscle mass, you've corrected some of the hormonal imbalances, and now your body can sustain that loss because you've established a baseline to keep your body metabolically fit, even off of that medication. Great. But that's not the case for most people. So they have a customer for life.
That's when the lady that was on 60 Minutes in the summer with Leslie Stahl or whenever, again, when you're old, you can't remember if it was last week or in the last 10 years, but it was in the last 12 months. And she told Leslie Stahl said, is obesity genetic? And she said, yes, which we're all saying, no. There are factors that play into this. And she's the one who said, well, that Ozempic is a great option for people. Well, guess who paid that lady $25,000 in 2021?
Yeah.
The company that makes Ozempic. People, follow the money. Yep. I mean, whoever's giving you advice, look and see if there's any connect, because there does have to be full disclosure with medical providers who are speaking on behalf, whether it's at a conference, a symposium, wherever. And you can Google these doctors who are saying, oh, I think this is the greatest thing since sliced bread. Check to see if there was a payday for them. Chances are there was. So,
yep. Yeah.
I mean, you hate to. I talked to a client the other day who was slim. She had some probably menopausal truncal weight gain, but still was fine in her clothes, but didn't feel great. And when we were going through things, she was telling me all the medicine she was on. She said, well, I'm on statins. I rolled my eyes because her mother had a heart attack. They put her on a statin, whatever. And high blood pressure medicine, which I said, well, I might need that. And then something for acid reflux. I said HCl betaine, but whatever. And when I told her, I said something about the doctor gets incentivized to write these prescriptions. Her husband was in the meeting with her, and they own a restaurant. And the husband said, sweetie, do you not know that most of the lunches that we send out are to drug reps who are entertaining doctors who tell about their drug? And he said, I think the restaurant must have to sign something saying, yes, John Smith picked up 50 box lunches for the people at Abbott Laboratory, in order probably to let your manager see the paper trail.
Oh, wow.
Because, money is exchanging hands. She was totally blown away by it. And she's 6 years old, totally blown away. And so that's what I'm telling anybody listening. Just follow the money, think about it. And then I say, if that's what you choose to do, great. Just make sure you're informed. And I'm sure that's kind of the feeling you have. What kind of medicine does your husband practice?
So he studied family medicine, but after the pandemic and residency, he's been doing urgent care, and then we've been building our own practice, integrated functional focus.
He leans on your side because there really are two different camps now. I mean, which is sad. And in some states, I know not in Florida because y'all are the freest place on the planet, but in some states, California, if providers don't recommend a certain vaccine, they can pull their license, they can slap them on the wrist. So they really do have to then read a script and say, I'm supposed to tell you that this is good for you and you have the option of taking it. Whereas you don't have that.
Yep, my license is in California, and I can't.
There you go. Yeah, because they could, and I guess the patient would be the one who would tattle to say, "She didn't tell me it was wonderful," and then you could get in trouble.
I would say it's usually somebody in the patient's family
who had a differing opinion.
Yeah. Correct. And they had someone that told them otherwise, and
That's when, and you've been practicing during the Google era, but you'll hear docs say, we used to practice medicine when no one got in their ear, including Dr. Google. Family members came to the meeting, they took notes, they let, if it's especially a malignancy or a chronic illness, and you had to get people involved. But then doctors now see that a patient comes in and said, this is what I think I have. This is what I think you need to give me. And then in that case, in certain cases, and if you don't tell me how wonderful these certain shots are and certain options, you could get in trouble. Yeah, you're doing the right thing by not saying a thing. She is keeping her mouth shut. What is your passion now? Is it to help women? If you and your husband have this, if you're looking at functional medicine, does he have this? It doesn't matter his passion, but do you still, is that your passion then for women and their health?
Yes, I still maintain. So, now I've shifted the focus of my practice. I have it more virtual. I do group coaching programs, and yes, helping women, like you said, to know what their body is telling them. I think for so long, so many women, and I've seen it in my own mom, the women in my family, they've had things that are just dismissed, normalized, oh, that's just how it is. You're just getting older. And I've had to have discussions, where I felt like I was being a little stern, but I'm like, stop telling me that you think this is normal because you're getting older when it's not. It's because, things are not balanced the way that they should. And you're not taking, we're dynamic beings, right? In a dynamic world. So as these environments around us and within us change, then we need to make those changes as well. but knowing how to tune in, like, okay, you know what, something is off here. And I want to create toolkits essentially for women where they can say like, okay, well, if this is off, then this is what I need to do. If I need to, maybe I need to do more of this or less of this, right? Because I think that's what it ultimately comes down to. It's never going to be just one way or one solution. So that's where
I'll
my passion
link
lies.
your website in the show notes for people to get that. Do you sell some of your own products? You mentioned something about the hair products. Do you have some of that?
Yes, that, and my other one is I call it a relax powder, because it contains inositol. So
Oh, it
inositol, a big one for
is.
PCOS. These are
I
the women
use
that
it
I
for
see
sleep.
largely.
Who else? It
Mm-hmm.
helps lower insulin? Oh,
Yeah,
okay.
it helps with blood sugar regulation. Yeah.
Yeah.
Yeah, but it does help with sleep. So again, when we talked about PCOS and that huge underlying stress component, that's why I like this, because it has magnesium, it has inositol, it has taurine, it has GABA, and it has L-theanine. So all that to just
That's
really take the edge off.
That's your glass of wine. Is that little pill or supplement? Good.
Exactly.
Powder. Okay.
It's a powder and it's unflavored, so that you don't have to worry about any of the extra, chemicals or flavorings, and it just mixes into anything. And then a tea, which I'm getting more of right now, but it's probably my favorite just because I love herbs. I love herbal medicine. So it's a nice blend to, again, help you get into that parasympathetic mode before bed, really make sure that you're digesting, as opposed to having to take, something, a medication
like
for
the HCl,
digestion, right?
The acid blocker that the girl was taking. And I was like, there are other options. So I love that. I've really, I've been introduced to inositol now for a couple of years, and I know it definitely helps. It's really good, and for what I was needing, just because when you do get postmenopausal, your sleep can get wonky if you're not getting sunlight in the morning, sunlight in the evening, and, regulating some stress and stuff.
Yes.
And it's very, very helpful. But I love, and another thing that I think menopause pushes us into is our thought for a need for a glass of wine because of the heart palpitations, the anxiety that goes with it. And I remember drinking wine. It didn't make me feel better, and it interrupted my sleep. So I wish I'd known about that.
Yeah.
Where were you 10 years ago? No, I'm kidding.
Yeah.
You're
I don't know if you use an aura, but
the reason
you
I
can
don't,
really
because I'll
see
overthink
how
it, and I don't want to obsess about it. My son wants to know why. He's surprised I don't have an Apple Watch too. And I said, because then I'd wake up in the middle of the night to see, what have I done? I've done a CGM a couple of times, and I have enjoyed that. Now that I'm a meat eater, it doesn't go up, it doesn't go down. It's pretty boring. But when I was eating more of my traditional diet, but I could almost obsess about it. And then that puts my cortisol doing this. So I have to tell my body nothing's on fire. In fact, I don't love knowing that I have the alopecia. I wish my hairdresser would have just taken something and treated it, because then it gets me on a spiral of, what are my melanocytes doing? And then you see what I'm saying? So I have to protect myself. My thyroid doctor told me 20 years ago, he said, well, your Hashimoto's is bad, but I could test you for Graves' disease. He said, but I'm not going to, because you'll catch it. I go, what do you mean? He goes, because I will tell you have it, and then you'll start obsessing and thinking you have all the symptoms. So you see what I have to say? I have to protect myself, which is why I turned off the news in March of 2020. Yeah. I have to protect myself. So, and we all have to find whatever works for us. But I know the people love the Aura rings, which, do you have yours on?
I do. Yeah. I mean, for me, it was because I was having chronic insomnia for a bit. But I just wanted to see what was helping and what wasn't helping. And the interesting thing I saw, the hugest the wine was
it's
the
so
worst,
inflammatory, and it keeps you up. And I've realized it doesn't have room in my life anymore. But if someone else drinks it, that's great. But if you are on bioidentical hormone replacement therapy, it could go down the estrone pathway. Just saying. Yeah. So there are a lot of things that has changed my mind. But I'm telling you, I thought I had to have it to cope during menopause because the heart palpitations. And in my mind, I would even think after I drank my one glass or two, I never had more, I would think my heart palpitations hadn't gone away. But I just kept thinking there was a connection. So good luck, inositol, and go to her website. So that's what I'll send people to do. They'll do that, and we'll make the world a better place. Thanks for being here. You're just a doll. Thank you so much.
Thanks for listening to the Lisa Fisher Said podcast. Be sure to hit subscribe and download all the episodes and leave a review, won't you? The Lisa Fisher Said podcast is produced by ClantonCreative.com.